Hey guys, how's it going? I wanted to talk about some common massage myths about pregnancy because, not to betray my profession, okay, I am a huge advocate for massage therapy. I think it's going to save the world. I could talk about it all day, but there's a lack of real education in the massage world when it comes to pregnancy and perinatal care. And so this is part of my mission. In addition to serving the moms that I see, I really want to lift up my profession and elevate the level of education and awareness and decrease the level of fear. There's so much fear with pregnancy. So let me dispel 3 of the main massage myths that you might hear. The first one is that you can't massage the feet. This one drives me crazy because if you've ever been pregnant, or even if you're just a person that stands on their feet all day, you know that your feet need work. Your feet need to be kneaded and they need to have all of that worked out. And in addition to that, the more that you work on your feet and your lower extremities, it helps with the lymphatic flow and with blood circulation and all of that. It is very, very healthy to work on the feet. The reason why there's this massage myth has to do with reflexology, which is an Eastern modality. It has to do with ancient Chinese medicine or traditional Chinese medicine, TCM. And there are some reflex points around the inside and the outside around the ankles, where if you stimulate, if you activate these points, they are associated with the reproductive organs. Now, I've taught reflexology before. I know a little bit about it. I'm not an expert, but I know enough to know that never in the history of ever has a woman been sent into labor by having her ankles rubbed or her feet massaged or anything in that area, let alone having somebody intentionally, like a reflexologist, intentionally stimulating those points. It just has never happened in the history of ever, okay? So just get rid of any fear and get that foot massage, mama, because you definitely deserve it. We all deserve some foot rubs in our day. So that's lie number 1. Second massage myth surrounding pregnancy is that you have to wait until you're 12 weeks or beyond, at least until your first try is in the rear view. Again, this one is completely based in fear. Most miscarriages tend to happen in the first trimester. So a lot of the time when that happens, if somebody's like had a massage, it's very natural and easy to understand why they might associate something bad happening with, oh, well, I just got a massage and this isn't something I usually do, so this must have led to this. Again, never in the history of ever has massage led to a miscarriage. In fact, I forget the actual title of the organization, but it's the National Association of Obstetricians and Gynecologists. They have a long list on their website of all of the things that are contraindicated and cautions during pregnancy. And guess what isn't on the list? Massage. So I'm just saying, like, there's just a lack of information out there and there's a lot of fear. So don't be afraid. Here at Mama Bear, we absolutely will see you from the moment that you realize you're pregnant, whether it's, first week, whatever. You can receive massage at any point in your pregnancy, any point up until delivery. I mean, there's labor and delivery massage to help you with your labor pains and to ease that whole process along too. So anyway, just don't be afraid of first trimester massage. Again, that's based in fear, and a lot of the time with other massage chains and these larger businesses, they're just afraid of the liability. So that's all that is. Again, it's just more fear. All right, myth number 3, last one we're going to talk about today, is deep tissue massage. Now, this is one that's really, again, like a mission for me because I've been a massage therapist since 2008, and most of my career has been based in pain relief, stress reduction, relaxation, like what I call therapeutic massage. It's a blend of remedial and relaxation work, but there's always some element of relieving the tension, relieving pain points, doing some more targeted work in certain spots. And again, with prenatal or perinatal work, a lot of the time what happens is a pregnant woman will go in for either a prenatal or a postpartum massage, and the therapist is so afraid to work on them, they're just basically like rubbing lotion on the skin and then charging them whatever they charge. And pregnant women not only can receive deep tissue work, they so deserve it and need it because they're carrying so much tension and pain in their body. I mean, if you're pregnant, I'm like preaching to the choir right now. You know, you have low back pain, you have hip pain, you have just new pain. Like your body is so rapidly changing, your joints hurt. So why would I ever deny somebody relief from that? That just seems to me just unethical and just wrong. But you can't just go at a client with deep tissue work the way that you would, you know, a regular non-pregnant client. So you have to know the limitations, you have to know the different limits that kind of exist within that. But when you're educated and you're experienced, you know what to do. And so this is what Mama Bear specializes in, is pain relief. Not just relaxation, but a blend of all of these things. When you relax the mind, the body follows, vice versa. Relaxation is always an ingredient in the recipe, but we're not afraid to get in there and really, really work on your back and your hips and your glutes and your hamstrings. And yes, there are some limitations to where we can apply deep tissue and for how long and in what, you know, body positions. There's some things we have to work with. But generally speaking, deep tissue is not contraindicated necessarily with a healthy, normal pregnancy. If you have any concerns about it, obviously talk to your OB-GYN. But 9 times out of 10, it's just so what is needed and deserved, and this is what we offer. So I hope that this helped clear up some of the massage myths, 3 of the major massage myths that are circulating out in the world. If you've heard any other ones and you want clarification, please comment below, and I'm happy to answer. All right, take care.